Patrick Doan. I'm a sports and exercise podiatrist and a professional strength and conditioning coach. I also have a background as a sports scientist and an exercise scientist.
So my name's Alex Murray. I'm a sports and exercise podiatrist, as well as a strength and conditioning coach and clinical educator.
So my background experience is I've been a podiatrist for about 8 years. I've worked in high performance sport for about 10 years in various different sporting codes such as AFL, rugby union, rugby league. I've done a little bit in soccer as well.
So my background, I've been working as a podiatrist for 8 years and a strength and conditioning coach for 2. I work in a predominantly MSK based podiatry setting. I'm a director and educator for Podiatry Systems, as well as the creator of the social media presence Making Sense in Podiatry, and a communication and education partner with the Cause Health project based out of Norway.
And I'm one of the presenters for the strength and conditioning workshop we have going on in Sydney and Melbourne.
Alongside Pat, I'm teaching workshops on strength and conditioning and musculoskeletal rehabilitation.
Alex has a great clinical background. His ability to translate to patients the contemporary research and literature and actually apply it in a practical setting is really invaluable.
Pat's strength and conditioning experience and expertise is where I come from, a more academic background with my postgraduate study and being very familiar with the research. It's very interesting how we've come to the same conclusions with very different approaches, and it really adds a lot of depth.
So the experiences that we've had in sport and also in the clinic room is something we'd love to share with you in the course.
In 2019, Pat saw a huge gap in the professional development market with the strength and conditioning course, the need for podiatrists to understand not only the principles and basis of strength and conditioning and how it impacts exercise prescription, but really that was a missing skill set that us as clinicians to work effectively in sport and exercise, as well as even in general MSK, really needed to shine and to stand out as professionals.
So the workshop will cover strength and conditioning, how you can use that in clinical practice. We'll cover a little bit around exercise prescription, load management, a lot of contemporary theories around how strength and conditioning can be something that can help someone who's injured and someone who's not injured. At the end of the workshop, you will have access to a quiz to get you an ACA Level 0 accreditation. A lot of these modules are ACA developed with a podiatry context that Alex and I have kind of put a spin on to kind of make it more relevant to podiatric practice. So this workshop's been running since 2019. We've been trying to get feedback from every workshop that we've provided, and a lot of the feedback is we do want to have a lot more things on pathology, a lot more information around case studies, which we have built into the course now, but for 2022 we're adding a second day, so the rehab day, which is on the Sunday. So in Sydney and Melbourne we have a workshop for rehab straight after the S&C workshop, and the beauty of that workshop is it's more rehab based rather than S&C, so it's incorporating the ideas you learn in the first day, and then we're using that to more pathological cases on the second day.
So the rehabilitation day that I'm developing is really focusing around what exactly that you do from start to finish with someone who comes in with injury or pain. So from the assessment, the initial appointment, all the way through to how we get them back to where they want to go, and potentially beyond that, not just returning them to play or returning them to their stated goal, but helping them develop a program after that. We don't just want to be returning someone to exactly where they were beforehand, where they got injured. So in the S&C day, we're focusing a lot on how to get someone stronger, fitter, faster, more conditioned to the activity that they want to do. Whereas in a rehabilitation day, we're focusing more on the patient in pain, and we're talking more about specific conditions and giving you a process when we're dealing with someone in pain and with an injury. So talking more in depth about the differences between tendon, bone, fascial injuries, neural injuries, Morton's neuroma, really getting much more in depth and taking all of those principles and ideas from strength and conditioning, but really giving a nice practical approach to how we then take that and apply that to the person in pain. And there's a lot of processes and procedures in that. We're really going to be teaching you a process of how to be able to see the person in front of you and be able to map an individual pathway from where they are to where they want to be, rather than a structure, a rigid sort of program of this is exactly what you do with every patient, or this is the typical program for a ankle sprain, this is the program for plantar heel pain. Is really being about an individual.
When attending a lot of workshops, it's hard to conceptualize how you can put these things into practice. The beauty of the practical content of our S&C and rehab workshops is you get to learn the theory module per module, and then we get to do it in practice in the gym. The reason we use gym-based settings for our workshops is we have all the equipment available. We can talk about all the theoretical content and then use it practically, but then also be able to discuss with our workshop participants what they need to do to start fitting out their clinics or their clinical rooms, and what equipment they might need when they want to start doing a bit of rehab and S&C in their clinical practice. So S&C's helped me change the way I practice in a musculoskeletal context, from the beginnings of taking a history through to my assessment and then formulating a plan, whether or not that's doing foot orthoses, prescription orthoses, changing someone's load and lifestyle management, changing how they approach their activity levels. Do I need to refer on, and do I need to involve other health professionals? It's more so S&C has given me a different perspective on how these injuries could occur and the contributors around how these injuries happen. And I guess management has evolved over the years with the more experience I've had. But it certainly hasn't changed my practice. It's more evolved it and refined it to the point where I can now work in an environment where both myself and the patient have a set goal, and we both work towards that goal with whatever strategies that we find suit best.
It's really allowed me to enjoy clinical practice a lot more, because I have the ability to think about patients as individuals, treat them as individuals, get really comfortable with that whole process. So I'm enjoying it. I'm not worried about what the outcome could be, if it's positive or negative, because I know I can deal with whatever happens, which is really what happens with patients. They don't always respond how we expect in the time that we expect them to.
I guess the goal and the mission of the S&C workshop is to kind of change the thought processes around injury, rehabilitation, and how to enhance someone's performance to return them to the task that they want to do. The main thing that we kind of look for in terms of change of a paradigm or mindset is, rather than getting someone pain-free, it's a kind of a return to performance mindset, which means the level that they were pre-injury, we want to return them back stronger than they were before, fitter, faster, so they can actually do that task and repeatedly do that task and sustain that long term.
From the rehab day, what I think people are going to be leaving with is a framework, a flexible framework that they can apply to pretty much every patient that they see. So what a process that they can follow from when the patient comes in, what we need to get out of the assessment, what we need to understand about their goal, and how we can process it. So whether you're seeing someone who is a pro level, elite level athlete compared to your general weekend warrior, or someone who's elderly, it's a way of thinking about where they're at and where they want to get, and how we can help along the way and adapt as new situations arise with that patient, or they don't respond.
I guess for musculoskeletal podiatrists and sports and exercise podiatrists, S&C is absolutely pivotal, understanding the principles and their foundations to kind of work in that rehabilitation context. Because understanding when to prescribe an exercise, how to increase it, how to change the load, how to increase the volume, I guess how that suits the individual patient as well is absolutely critical.
I think this workshop is really useful for people who see biomechanical patients or musculoskeletal patients who do rehabilitation in some form and really want to enjoy their work. For me, practicing in this way has been immensely enjoyable and rewarding, and has given me the framework to be able to grow, rather than sort of following structured programs which do and don't work, and not knowing how to go or where to go from there.
And there are podiatrists in, I guess, regional and rural areas where they may not have access to high-end services like, sports doctors, orthopedic surgeons, sports and muscle physios. Having this background context allows you to be that person, I guess, in that sort of environment to be able to manage these injuries and then have the skill set to, I guess, refer on or at least do something to help that patient that comes through the door that's quite complex and, it's just you. So for our 2022 Rehab and S&C workshops, we've been privileged enough to acquire 2 great locations for our face-to-face workshops. For Melbourne, we're going back to where we were in 2019, which is Core Advantage with Durham McMinnis. Durham owns a big strength and conditioning facility down in Oakley. He has been head of performance for Basketball Victoria for a number of years, and it's a great venue. Our Sydney location is based in Artarmon at Athletes Authority with Lachlan Wilmot. Lachlan's been very gracious as he is a board member of the ASCA, but he's also worked with GWS as a strength and conditioning coach and also head of performance at Parramatta Eels. So they're both great facilities for both rehab and S&C.